From Diamond Pharmacy Services, this is PodcastRx, a monthly show that takes you behind the counter of the nation's largest correctional pharmacy provider. We bring you conversations with pharmacists, nurses, managers, and other Diamond staff about the topics and issues we see in corrections, long-term care, and community health settings. Our chats aren't limited to purely pharmacy topics, and they aren't strictly clinical either. So if you're a healthcare provider or just enjoy healthcare podcasts, we think you'll enjoy this show. On this episode, we welcome back Judy Tomayko, Senior Respiratory Therapist and Infection Control Coordinator for Diamond Medical Supply. The fall of 2021 has been a trying time for Judy and her respiratory care team, as they've taken on an unprecedented surge in respiratory patients and dealt with various respiratory equipment shortages, all thanks to COVID-19. We discuss these and other difficulties, along with her outlook and advice for patients in the coming months. And we also learn about the recent expansion of Judy's respiratory care department and what she and her fellow therapists hope to achieve moving forward. I'm Adam Campbell. This is PodcastRx. Well, I want to welcome back to PodcastRx Judy Tomayko. For those just meeting Judy for the first time, she is the Senior Respiratory Therapist and the Infection Control Coordinator for Diamond Medical Supply. Judy, thanks for being here again. Absolutely. You know, we talked back in January in a retrospective sort of way about your experiences in respiratory care over the first 10 months or so of the pandemic. Now, just to clarify for people listening, your respiratory care umbrella is primarily over home care patients and for folks in skilled nursing and assisted living facilities. Now, you're working with doctors, with families to coordinate respiratory care, whether that's oxygen therapy, CPAPs, BiPAPs, the whole gamut. And while your respiratory care experience was and is a lot different than, say, maybe a hospital respiratory care therapist working in an ICU, you still had a lot of unique challenges and worried patients to help. COVID's a respiratory disease after all. So I wanted to follow up on our conversation from episode 17, Respiratory Reflections, for those of you who haven't listened to that, on a few of those challenges and see what a difference 7 months has made. So Judy, the last time we talked about how you faced certain instabilities in the first 12 months of the pandemic, shortages of PPE early on, then shortages of respiratory equipment and oxygen during the second wave in the winter. So how is everything holding up with regard to respiratory resources these days now that we have a kind of a little bit of a surge going on here in Indiana County?
Well, I'd like to say that I could bring some good news to the situation, but regarding the PPE, the protective equipment, that is actually in good shape. I mean, we've had no issues with acquiring that, and I do believe at the beginning people were wise enough to place some nice orders, not knowing how the future was going to play out for everyone. But I have to say, this new wave that we're having is unprecedented in this area. It's fierce. It's in Indiana County and our areas are surrounding us. It has been difficult. It really has. Oxygen equipment, DME equipment you can get it, but there seems to be a lot of wait times for those items. Mm-hmm. Oxygen tanks themselves are on a national shortage.
Wow.
So we actually placed a large order for oxygen cylinders that we fill ourselves here at Diamond. So we always have a well-stocked of oxygen. We placed an order in April and we still haven't received those yet. And it's widespread. I mean, everyone is going through this, but we have been very, very proactive and staying on top of the ordering process to making sure that we have everything for not only our community, but all of our customers.
Yeah. What types of DME in particular are in shortage right now?
Hospital beds, the wheelchairs. Mm-hmm. And I think a lot of it has to do with a lot of the shipping issues.
Yeah.
I know that a lot of the items are ready to come here, but it's taken longer times for things to be shipped in. So that has always been an issue, during these times.
When you said that it was fierce, this recent wave, how does that stand out in, say, the early parts of the pandemic, even last winter's surge?
We are setting up about 3 times as many patients than we did during the first 2 waves, since it actually started. This wave seems more critical in regards to the hospital is in need of making more space, for more critical patients.
Right.
So we are accruing more patients directly from the emergency department, just to make more room. Some patients don't even make it that far. They're just prescribed oxygen from the doctor's office. And so we're picking them up there because we really do want to try to keep these patients at home, to care for them at home, which is also the fact that, you're quarantining yourself. So these patients are at home by themselves a lot, and they don't have advocates. And sometimes we might be the only advocate between the physician, the family, to keep things rolling and keeping an eye on our patients.
Yeah. Something that we talked about in that last episode, how respiratory therapists are these unsung heroes during these times. And I think that's another great example of it right there.
Absolutely.
Especially the advocacy part. Away from the home care for a sec, how about things in the skilled and personal care facilities? We talked about last time you had to do some improvised videos to show people how to get the equipment to work best for them, the respiratory equipment. How are things there?
I think the skilled and personal care home facilities have been doing a phenomenal job, because I know they're, like everyone else, they're short-staffed. They're run ragged right now. But I have seen a great improvement with this wave in regards to the numbers that we're seeing out there. And I don't know if it's true the fact that the vaccinations have helped, obviously, but also they've learned a lot along the way of how to care for these patients, how to care for themselves also, and to get the equipment that they need to take care of the patients there in skilled facilities. But they are so much better this time around. That's
great. It's great to hear. As far as infection control coordination goes, it's a big part of your job. Here at Diamond Medical Supply, you're the infection control coordinator. How are you handling infection control differently than a year ago, even maybe 6 months ago? You still using the color-coded system that you talked about last episode for patients? I believe it was purple for COVID. Is there still a moratorium on home visits? Are you still doing things like helping patients on their porches when necessary?
We really haven't changed that much since this whole pandemic has started.
Okay.
We do still use the color coding system just to notify our delivery technicians and everyone across the board that's going to be caring for those patients that that patient does have an infection that they need to be aware of. And that's what is nice about our color coding system. We've used it for years, not even just for COVID, for other infectious diseases that we need to be aware of and take care with. And we haven't really changed too much. We're still mandating the mask. We're still asking the patients when we go out to wear a mask. We still screen our patients quite vigorously. And we treat every delivery and setup individually, because you have to look at, is the patient positive? If they're positive for COVID, do they have a caregiver that can be there that we can educate? Or do we do the equipment setup before the patient gets home? And we have been continuing to do the setups and education anywhere we can in regards to front porches, the decks, and so forth. It does not mean, however, that we're minimizing our education or our care. It's just that you have to kind of tweak things as you go.
Yeah, definitely. That's a mantra for a lot of folks over the last year and a half. The reason I wanted to ask you that question about that is because things are a little different. Even getting into the building here at Diamond Medical Supply, for instance, you used to have the door was locked and you'd be paged and things like that. And I know just with the vaccines being more available, I wasn't sure, did any restrictions or guidelines, anything like that with regard to infection control, I don't want to say like relaxed, but was it maybe refocused? And you answered that. Yeah,
everything is primarily the same. We're trying to keep not only our patients safe, their family members and caregivers, but also Diamond staff. We want to make sure that they're healthy so they don't take anything home to their families also.
Absolutely. Okay, let me see here. All right. So, of course, the big difference between our January conversation and now has been the rollout of the vaccines. They were just starting to really hit the general public, I believe, when we talked. I know they were being rolled out in the institutional settings. But, we've had those vaccines widely available now for several months. And as President Biden said in a recent speech, this is a pandemic of the unvaccinated. So, are a lot of the cases, are you seeing a lot of these cases with people who are, to your knowledge, unvaccinated with the respiratory setups that you're doing?
Unfortunately, yes. We have been
So, of course, the big difference between our January conversation and now has been the rollout of the vaccines. They were just starting to really hit the general public, I believe, when we talked. I know they were being rolled out in the institutional settings. But We've had those vaccines widely available now for several months. And as President Biden said in a recent speech, this is a pandemic of the unvaccinated. So are a lot of the cases, are you seeing a lot of these cases with people who are, to your knowledge, unvaccinated with the respiratory setups that you're doing?
Unfortunately, yes. We have been. Most of our patients that are being treated with home oxygen therapy are not vaccinated. However, we are seeing breakthrough cases that are still requiring oxygen therapy at home. And I guess that's par for the course. But yeah, we are seeing it. But unfortunately, we are seeing most of the patients are unvaccinated.
Yeah. How most of the patients are unvaccinated. As far as those breakthrough cases, is there a big number of those?
No, there's not. There's a handful. And they're a little bit easier to manage. They're not requiring the higher oxygen flow rates that others might require. So I don't think they're quite as sick.
Good. And that's of course owing to the, just how much the vaccines are working.
Hopefully, yes.
If there's those breakthrough cases, it's still minimizing your chance for severe disease and illness.
Thanks for listening to PodcastRx from Diamond Pharmacy Services. If you're a fan of the show and have any topics you'd like to hear us discuss, or if you have any thoughts on a particular episode you'd like to share, please email us at podcastrx@diamondpharmacy.com. And while you're at it, please rate and review our show wherever you get your podcasts. Your feedback helps us make the best show possible for you. And as always, we appreciate your feedback and support. Now back to the show.
While we're talking about vaccination, has that been something that as a respiratory therapist, you and the team have been adding to your educational efforts? Have you been talking to them about vaccines? Like if they haven't been advocating?
Have, yeah. Whenever we do our either our home visits to follow up with the patient, see how they are doing clinically, or we are doing telehealth follow-ups also, we do discuss with them if they were vaccinated, and if they weren't, why weren't they? Is there any education that we can provide to them that would help them along the way to maybe push them to have a discussion with their physician to see what is best for them?
One of the scarier things about COVID-19 were these long-haul symptoms. That's what some people are having after they recover from having COVID. And that symptoms involve shortness of breath, trouble breathing. That's some of the more notable symptoms. There are a bunch more, but has your respiratory team had to address any cases of long-haul COVID symptoms with people with breathing problems? And if not, how are you approaching treatment or planning to approach treatment for this relatively new phenomenon?
That's what it is. It's new. They really don't know exactly how long it's going to last, what is the best course of action for these patients. What I do know is that we do have a few patients that had COVID early last year, and they're still being treated with oxygen therapy. So it has done some lung damage to them. Right now, we're treating them like we would any type of oxygen-dependent individual until more research comes about. I know that there's different fields of care that they are doing research to find out how they can ease this.
So with winter coming, Judy, with Delta variant still a threat, of course, now we're into cold and flu season. If you can't hear it in my own voice here, a little scratchy. I think my son brought that home from daycare, but anyway. With that, what proactive measures are you recommending respiratory patients take to prepare themselves?
Well, first of all, we do encourage patients to get vaccinated, not only just with the COVID vaccine, but also get your flu vaccine. If you're sick, stay home, take care of yourselves. Kind of the same procedures we've done during flu seasons for years. And then just with the occurrence of COVID, utilizing the same type of health factors and taking care of yourself, talking to your physician if something occurs. Don't wait too long. If you start getting sick, especially with our long-term lung patients, seek health care as soon as you start seeing some symptoms come across.
Our last conversation we had was ending on a relatively positive note. As I mentioned, the vaccines were on their way for everybody back in January. It seemed like things were really turning the corner. And given that our immediate area here, Indiana County, at least at the time of this recording, September 24th, is experiencing rising COVID case numbers. It's got a lower vaccination rate than many of the neighboring counties. Do you still feel as optimistic that we're going to put this COVID on the back burner here relatively soon, or do you feel differently?
That's a good question. I would love to say that I feel positive that we're turning the corner. I would love to be able to say that. But right now, in the midst of everything, I still think we have some time left. I think the further this go, the more educated people get, I think you're going to see those percentages of unvaccinated people go down. I think people are going to be more versed to go out there and get the vaccine. But right now, it's a little bit scary. And you just really want to be there for the patient, educate them so they can make the right decision. But right now, in the midst of things, I don't know where this is going to end.
I think for some context for the listeners, it's important to say this, that we wanted to record this show a couple days ago, and you emailed me and said, Adam, could we please reschedule? Don't kill me. But, it's just COVID craziness now with ordering supplies.
It is.
And I was like, wow, this seems a lot different than our last time trying to get this on the books.
Who'd ever thought that we'd be in a situation like this? You never would have thought that things would be in short supply or hard to get in our area. I don't know if it just it's slower to hit our area, that we have increased our ordering. We have increased the amount we're ordering, because if we can get it today, let's get more of it, just so we are prepared, because we don't know what the future is going to hold in regards to, we can have waves like this every few months. You don't know. So we have to be prepared.
Would you say then in the respiratory care world that's been the toughest thing of most recently, has just been the supply thing, or has there been anything else just as tough?
I think the suffering. These people are really out there, and the exhaustion of the healthcare workers, or anyone that's forced to be with this every day on a daily basis. And right now it is just, it's all over. It's the exhaustion. It's the scared future that we have. It's unknown right now where this is heading and how soon hopefully it will end for all of us. But I think the supply factor, keeping everyone safe, is also, and making them realize that you can't take shortcuts. You really have to play, strict ball here to keep yourself and your family safe.
I'll ask one last question before we take a break from the COVID questions. One thing that, when I've talked to you in the past, whether for this or for other interview projects that we've done with the respiratory care team, you talk about how you're such a source of reassurance for patients. And have you had to do a lot more of that reassurance in the time of COVID? Have they been leaning on you harder for support during this whole time?
Oh, they have. And, we're happy to do that. We really are. Again, you have these patients out there, they're in quarantine. They're out there on high liter flows. They don't feel good. They don't, per se, remember a lot of how to care for their equipment or utilize their equipment. So constantly reviewing things with them, making them feel comfortable. And again, having them reach out to the physicians as soon as they start feeling any worse is vital. Just letting them know that we're here, because they're not getting visitors. They're not, it's really hard to think of, we have 80 and 90-year-old individuals that are home by themselves. And it's hard. You got new equipment there. You don't know how to run it. It's loud. It's scary. So we are here to help them out along the way.
We hope you are enjoying our conversation with Judy about respiratory care. If you live near Indiana, Pennsylvania, and you think Judy and her team could help you or someone you care about with a respiratory issue, get in touch with us. Our registered respiratory therapist will educate you about treatments and thoroughly train you to use oxygen, nebulizers, CPAPs, BiPAPs, or any specialty equipment. And just like Judy said, they will be a round-the-clock resource for you, answering all questions, no matter what time and no matter how simple. To get started, please call Diamond Medical Supply at 724-349-2830 or email rrt@diamondpharmacy.com. And now, back to the show.
We're back on PodcastRx with Judy Tomayko, Senior Respiratory Therapist for Diamond Medical Supply. So we're going to get away from the COVID discussion for a bit. We're just a few weeks away from Respiratory Care Week, and I wanted to talk to you about some changes in your respiratory care department. First, I understand you have a new member of the team. Can you tell us more about that?
Yes, our new therapist, her name is Jamie, and she has become a great contribution to our department. She has a lot of experience, very kind and very knowledgeable. And we really found that we needed another therapist on staff, not just to handle our current influx of patients, but also we see ourselves, growing and expanding in the future. So we want to make sure that we're prepared to take care of the patients and give them what they need by having another therapist aboard.
Yeah, speaking of growth and expansion, I don't think since I've been here, since I've known you, that you've ever had more than 3 total therapists on your team.
It's very exciting. I am
can
very
imagine.
excited that we're moving forward with things and we're growing in ways that we've always wanted to grow. We want to be a substantial supporter of our community, and that's just one more piece of the puzzle that is going to help us.
That's excellent news. You said her name was
Jamie.
Jamie, right? And just for listeners who aren't familiar with the team, Jamie joins Judy, Deb, and Stacy.
Correct. Yep.
And if you go on our Diamond Pharmacy Services YouTube channel, there's a video there about the respiratory care team. Obviously, Jamie's not on it, being that she just started, but you
We'll
can
get
get
her
to know
in.
the rest. Yes, we will eventually get her on there. So talking about the expansion of your team and the things you want to do, what are some of those more specific goals, the ways that you want to serve the community with more respiratory therapy power, so to speak?
One avenue that we're looking to expand, in which we were planning on adding to our service line prior to the pandemic, is ventilator use in the homes. That is per recommendation from a few of the physicians here in Indiana to be able to supply that. And don't want to pat ourselves on the back, but they know, they reached out to us. They want us to be the primary supplier of the ventilators in our area, but due to the pandemic, as everyone knows, the ventilators are hard to come by.
Sure. Yeah.
And then Respironics has a recall right now going on with some of their units, so it's kind of impossible. And for us to jump in full force the way we want to and do things the way we want to, we're going to put that on the pause till all this is calmed down a little bit.
Yeah, sure. That's great. And as I said just a couple minutes ago, we're a few weeks away from Respiratory Care Week. Their theme for this year is resilience, strength, and hope. So given some of the heavy things we talked about in the first segment, how are you and your colleagues staying resilient, strong, and hopeful as we head into a winter of uncertainty, so to speak?
That's a really great theme for this year for respiratory care and anyone in the healthcare or other areas of care that's been needed through the pandemic. And our team and also our local hospital and our home care agencies have been going through this a lot, and they're all demonstrating the same thing and staying strong, doing what we have to do. This is a great theme for this year in regards to all healthcare suppliers, home care agencies, hospital, and all aspects of care, resilience, strength, and hope. And that's just evident with what they've been through this past year and in the future, what they're going to be doing to keep this pandemic and keep people safe through this time. Resilience, that's every day, that's coming in and doing the job the best you can and supporting the patients in the community, getting what they need. And I've seen that firsthand in everyone in this community. Everyone's working hard, and you don't hear anyone complaining. They're going and doing their job. They're caring for the patients that they need and keeping strong during this time, because it's not easy. It's not easy to go into an area of care that you're putting yourself and maybe your family's health at risk, but they keep moving forward and helping out as any way they can. And of course, hope. If we didn't have hope, we wouldn't have much going on. So the hope of the individuals caring this year and in the future years is there, and everyone's hopeful that this is all going to end soon and hoping for the best outcome for everyone.
For sure. And just about the respiratory care profession in general, do you think that this whole pandemic experience and the way that it's brought to light the respiratory care profession, do you think you're going to see an uptick in people going into that? I know you'd like to, but do you think that's...
I think it's needed, but it's funny you said that, because I'm always wondering, is this pandemic scaring people away from going into the healthcare fields? I hope not, though. But yeah, I do think people don't usually hear about respiratory care until you need it.
Right.
And with the pandemic and here on the national news of respiratory care, you never heard us being mentioned before. So that is exciting, and I'm hoping it's going to continue, not just through this time, because there's a lot of great opportunities out there for individuals to seek profession in respiratory care. And I'm hoping that's the case. I hope people will start flooding the field, should I say. But again, I don't know. Is it going to scare people away? I don't know. I hope not.
Yeah. Well, even from having talked to you and your the rest of your team for that video that I mentioned, the reasons that you all got into it were very different, but at the same time, it was neat how you fell into it. And now people could say things like, well, I had a relative that had COVID and it made me interested in their respiratory health and how I could help. So
yeah, absolutely.
Just to see how it does drive people.
Yeah, into the field. And any healthcare field, is greatly needed right now. But respiratory, I'm hoping that really brought some light to the occupation itself, because it's a very fulfilling job. So I'm hoping.
And we're hoping so too. And how do you plan to celebrate Respiratory Care Week? You always do some fun things for your staff and for some clients.
I do. I have some hidden things in my pockets, and I think we're going to have some fun. I think they're well deserving of a great week. And it's not only just our respiratory therapists that we have here. We have some great technicians that are over the top, probably the best that you can ever find. Yeah. And they're going to be included in the celebration, and we'll do something all week for them, and hopefully they'll enjoy it and get a little bit of fun out of it. All
right. Well, Judy, I do want to say how much we do appreciate you and the efforts of your respiratory care team, and wish you a very happy Respiratory Care Week celebration. Not, obviously not just limited to that week, but everything going forward. And thanks for all you do to help your patients, not just in pandemic times, but all the time. And we hope that this podcast helps to raise that profile of respiratory care even more. So,
well, thank you for having me. I really appreciate you guys reaching out to us. And if anyone, wants to speak to us, they can always reach out to us at Diamonds. And we'll be happy to answer any questions they might have.
Yeah. Well, thank you again, Judy. And I'm sure we'll be asking you to do this again sometime soon.
Okay, sounds good.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.